Strange signs and symptoms of liver damage. Approximately 1.8% of US adults, 4.5 million, have liver disease. It causes about 57,000 US deaths a year. Globally, it causes about 2 million deaths per year, or 4% of all deaths. Deaths are mostly from complications of cirrhosis, with acute liver failure accounting for a small portion. Liver disease affects men and people assigned male at birth, twice as often as women and people assigned female at birth. There are many types of liver disease. Some of the most common types are treatable with diet and lifestyle changes, while others may require lifelong medication to manage. If you begin treatment early enough, you can often prevent permanent damage, but you may not have symptoms in the early stages. Late-stage liver disease is more complicated to treat. Your liver is a large and powerful organ that performs hundreds of essential functions in your body. One of its most important functions is filtering toxins from your blood. While your liver is well equipped for this job, its role as a filter makes it vulnerable to the toxin it processes. Too many toxins can overwhelm your liver's resources and ability to function. This can happen temporarily or over a long period of time. Your liver has great regenerative powers, but constantly working over time to restore itself takes its toll. Eventually, it can't keep up. Early signs and symptoms. Generally feeling unwell and tired all the time, loss of appetite, loss of weight and muscle wasting, feeling sick, nausea and vomiting, tenderness, pain in the liver area, spider-like small blood capillaries on the skin above your waist level, spider angiomas, blotchy red palms, disturbed sleep patterns. Later signs and symptoms as the liver is struggling to function. Intensely itchy skin, yellowing of the white of the eyes and the skin, jaundice, white nails, end of fingers become wider, thicker, clubbed fingers, hair loss, swelling of the legs, ankles, feet, edema, swelling of the abdomen, ascites, dark urine, pale colored stool or very dark black tarry stools, frequent nosebleeds and bleeding gums, easy bruising and difficulty in stopping small bleeds, vomiting blood, frequent muscle cramps, right shoulder pain. In men, enlarged breast and shrunken testes. In women, irregular or lack of menstrual periods, impotence and loss of sexual desire, dizziness and extreme fatigue, anemia, shortness of breath, very rapid heartbeats, tachycardia, fevers with high temperature and shivers, forgetfulness, memory loss, confusion and drowsiness, subtle change in personality, trembling hands, writing becomes difficult, spidery and small, staggering gait when walking, tendency to fall, increased sensitivity to drugs, both medical and recreational, increased sensitivity to alcohol. Red flag symptoms. If you have any of the following symptoms, you must see a doctor straight away, especially if you have been diagnosed recently with cirrhosis. Fever with high temperatures and shivers, often caused by an infection, shortness of breath, vomiting blood, very dark or black tarry stools, feces, periods of mental confusion or drowsiness. Although these symptoms may seem very different because your liver is responsible for so many different functions, if it stops working properly, it can result to a range of problems. What are the stages of chronic liver disease? Chronic liver disease progresses in roughly 4 stages. Stage 1, hepatitis. Hepatitis means inflammation in your liver tissues. Inflammation is your liver's response to injury or toxicity. It's an attempt to purge infections and start the healing process. Acute hepatitis, an immediate and temporary response, often accomplishes this, but when the injury or toxicity continues, so does the inflammation. Chronic hepatitis causes hyperactive healing that eventually results in scarring, fibrosis. Stage 2, fibrosis. Fibrosis is a gradual stiffening of your liver as thin bands of scar tissue gradually add up. Scar tissue reduces blood flow through your liver, which reduces its access to oxygen and nutrients. This is how your liver's vitality begins to gradually decline. Remarkably, some amount of fibrosis is reversible. Your liver cells can regenerate, and scarring can diminish if damage slows down enough for it to recover. Stage 3, cirrhosis. Cirrhosis is severe permanent scarring in your liver. This is the stage where fibrosis is no longer reversible, when your liver no longer has enough healthy cells left to work with. Its tissue can no longer regenerate, but you can still slow or stop the damage at this stage. Cirrhosis will begin to affect your liver function, but your body will attempt to compensate for the loss, so you might not notice at first. Stage 4, liver failure. Liver failure begins when your liver can no longer function adequately for your body's needs. This is also called decompensated cirrhosis. Your body can no longer compensate for the losses. As liver functions begin to break down, you will begin to feel the effects throughout your body. Chronic liver failure is a gradual process, but it is eventually fatal without a liver transplant. You need a liver to live. Causes of liver disease. There are over 100 types of liver disease, but they fall into a handful of subtypes. Causes include viral infection. Viral hepatitis infections that become chronic can cause chronic hepatitis, including hepatitis B and hepatitis C. Alcohol-induced hepatitis. Heavy alcohol use can cause acute or chronic hepatitis. If it goes on long enough, it can cause cirrhosis and liver failure. Toxic hepatitis. Chronic overexposure to toxins, such as industrial chemicals or drugs, can cause acute or chronic hepatitis. Non-alcoholic related fatty liver disease. Metabolic condition associated with obesity, high blood sugar, and high blood lipids can cause excess fat storage in your liver, which can cause inflammation. Non-alcoholic related steatohepatitis. Biliary stasis. Congenital, a condition present at birth that obstructs or stop flow of bile through your bile ducts, can cause bile to build up and injure your liver, including biliary atresia and cystic fibrosis. Non-congenital causes include biliary stricture and gallstones. Autoimmune diseases. Autoimmune condition can cause chronic inflammation and scarring in your liver or your bile ducts, including autoimmune hepatitis, primary biliary cholangitis, and primary sclerosing cholangitis. Inherited metabolic disorders. Disorders that cause toxic products to build up in your body, such as glycogen storage disease, GSD, Wilson disease, hemochromatosis, and Gaucher disease, can cause chronic liver damage. Cardiovascular diseases. Conditions that affect blood flow to and from your liver, including Budd-Chiari syndrome, ischemia, arterial diseases, and right-sided heart failure, can cause chronic liver damage. Risk factors for acquiring liver disease. You may be more likely to get liver disease if you drink alcohol heavily, use intravenous drugs, use pain relievers like aspirin or acetaminophen, have metabolic syndrome, are regularly exposed to toxic chemicals, are regularly exposed to other people's blood or body fluids. How to lower your risk of liver disease. You can help prevent liver disease by getting vaccinated. Vaccines are available to prevent viral hepatitis A and B. Practice good hygiene. Hand washing after using the bathroom. Safe food handling and safe needle use can help prevent infections from spreading. Drinking alcohol in moderation and using medications as directed. If you have a substance use disorder, treatment can help prevent toxic hepatitis. Managing metabolic factors such as your blood lipids and blood sugar. A healthcare provider can help with this. Can liver disease be reversed? Liver disease can be reversed in the early stages if you and your healthcare team are able to remove or manage the cause effectively. This depends on the cause and how treatable it is. Once you have cirrhosis, you can't undo the scarring that's already been done, but you may be able to prevent further damage or slow it down. Chronic liver failure is not reversible, though it can still take years to progress. Is liver disease curable? Many types of liver disease are curable. Toxic and alcohol-related liver disease can improve when you are no longer exposed to the toxin. Diet and lifestyle changes can relieve non-alcohol-related fatty liver disease. Other types of liver disease are not curable, but they are often manageable with medications. Certain inherited diseases, autoimmune diseases, and viral infections may need lifelong treatment. Your liver plays such a large role in your overall health that when it's sick, it affects you in all kinds of ways, but you won't always feel the effect of liver disease until it's already advanced. To protect your liver, it's important to be aware of the kinds of things that can harm it and try to avoid those things. Keeping up with your regular healthcare checkups can also help you catch liver disease sooner rather than later. Thanks for watching to the end. I hope this video has been informative and helpful. If you like this video and you would like to see more content like this, kindly like, share, leave a comment in the comment section, and also please subscribe to this channel if you have not already subscribed yet. Thanks for watching to the end. Have a nice day and look out for the next video.